Hi guys, Dr. Sims here. Today I want to talk about something that's very important for your health. That is vitamin D. Now, if I were going to stop right there, I'm sure that wouldn't be anything that you haven't heard before. But the truth is, most people really don't know how important vitamin D is to their health. Also, vitamin D deficiency is linked to a more severe reaction to the COVID-19 virus.
This content is not intended to be a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a health condition.
Today, with the world trying to fight against the virus, vitamin D could actually prove to be the most crucial and important vitamin in combating it. The good news is, your body makes vitamin D in the right conditions. But let's back up a little bit first. What does vitamin D do? Now, I'm sure you've heard a lot about vitamin D and maintaining strong and healthy bones and teeth. And that is true. Without sufficient amounts of vitamin D in your body, your bones won't grow properly and can become thin and brittle. But vitamin D is very important for a lot of different areas in your body. Did you know that vitamin D plays a crucial role in your immune system, and more specifically in fighting against viruses? Vitamin D has a major role in the immune defense of the respiratory system through direct inactivation of viral pathogens. A number of white blood cells have receptor sites for vitamin D, and it is important for the maturation of immune cells. So what does all that mean? To put it simply, vitamin D helps your body destroy viruses. Sounds great, right? Well, the problem is, a large percentage of the population is vitamin D deficient. Studies have suggested that 50% of the general population in America are vitamin D deficient. 70% of the elderly are vitamin D deficient, and 90% of people of color are vitamin D deficient. Vitamin D deficiency plays a major role in a lot of chronic diseases, such as diabetes, high blood pressure, and cardiovascular disease. So that means that the most vulnerable groups of the population for COVID-19 are also the ones that have the highest vitamin D deficiency. I'm sure you've heard that there have been reports that people of color are more negatively affected by this virus, that they have more severe reaction to it. Now, some people try to relate this to income inequality or to access to health care, but that's really just not true at all. How do I know? Because the findings were the same in England as they were in America. And in England, they have universal health care. The report says that people of color are at more risk for dying from COVID-19 even after adjusting for geographic location. The hypothesis right now comes back to vitamin D. Did you know that people of color require 6 times as much sunlight for their bodies to produce the same amount of vitamin D as their white friends? The truth is, the darker your skin is, the more sunlight you need in order for your body to produce enough vitamin D. That's also why my ginger friends can just walk outside and they get sunburn. Sunburn is the body's defense, darkening the skin, trying to prevent the absorption of the sun's rays. More specifically, UVB. UVB is what the body uses to convert cholesterol into vitamin D. While sunscreen is great for preventing a sunburn, and in turn decreasing your chances of getting skin cancer in the future, it also blocks UVB, and in turn blocks the body's ability to make vitamin D from the sunlight. I'm not saying ignore sunscreen altogether, but what I am saying is that your body does need some time exposed to the sun without anything blocking it. The amount of time will be different for everyone depending on your skin type. So how does the body make vitamin D? Well, like I said earlier, the UVB rays from the sun hit the skin and convert cholesterol that's in the bloodstream into vitamin D. It's not in a form your body can use yet though. First, it needs to go through a couple chemical reactions in the liver and then the kidneys before your body can use it. So when you think about vitamin D, something else you need to think about is the health of your liver and kidneys. It might be a good idea if you're someone that's not getting enough vitamin D from, let's say, the sun or food sources to supplement that vitamin D. If you want to know if you're vitamin D deficient, I would suggest talking to your medical doctor. They can do some blood work and test the vitamin D in your body, and then recommend a supplementation amount that's right for you. Another important thing to consider is fructose. More specifically, high fructose corn syrup. America is the #1 consumer of high fructose corn syrup in the world. As a matter of fact, it's actually banned in a lot of other countries. Studies have shown high levels of fructose in your diet can cause a decrease in vitamin D levels in your blood. So if you want to be healthy as possible, you definitely want to avoid putting any high fructose corn syrup in your mouth. One final thought. We have seen an increase in COVID-19 cases where I live in Texas and a lot of other southern states. Now, one aspect of that could be testing. We are doing a significantly higher amount of tests than we were in the past. Following along with the vitamin D theory, you would think that cases would be lower in states that get more sunshine. Well, I think weather has something to do with it, but not in the way that you're thinking. Some of the hottest states in the country are the ones that we're seeing a spike in cases. Think about it. It's 100 degrees outside and we're in lockdown. The pools are closed, so we're not going outside unless we absolutely have to. People have been lethargic. Maybe not eating the best. In the AC, so not getting any fresh air, so they're suffering from an acute or very short-term vitamin D deficiency. Now they need to go back to work, and it's the perfect conditions for the virus to start to spread. That's why my recommendations have been to get outside as much as possible during this time. To summarize, a large percentage of Americans are vitamin D deficient. Avoid anything with high levels of fructose in it, and go outside as much as possible. There have not been any randomized controlled trials of COVID-19 and vitamin D yet. However, the hypothesis for right now is the best way to prevent a severe reaction to COVID-19 is vitamin D. If you got any value from this video, hit the like button and please share it. Subscribe to our channel so that you can be notified of when future videos come out. Drop a comment if you have a question or if there's something that you'd like to learn about in future videos. Thanks and have a great day.